Equinoxe.
Hello everyone, thank you for staying with us on today's edition of the program You and Your Health aired on Equinoxe Radio. It is a pleasure being with you all. Knowing what to eat as a gastric patient is very essential. Following a gastritis-friendly diet can go a long way towards relieving your symptoms and helping you feel better. For some people, eating fried, spicy or highly acidic food can trigger their gastritis. On today's edition of the program, we'll tell you more about what really gastritis is, but that will be after the short break. Stay with us. Welcome back. With me in the studio is Dr. Glory Befeke. She is a general practitioner right here in the city of Douala. It is a pleasure having you on the program today.
Thank you, Immaculate.
Today we will be looking at gastritis. What really is it?
Gastritis is, simply inflammation of the stomach lining. Inflammation of the stomach lining. That's a simple definition of gastritis.
When you say the stomach lining, does it mean I can just look at someone's stomach and see it's a little bit inflamed or big and tell that's gastritis?
Right. It is a lining that is found within the stomach.
Okay.
Within the stomach, that is not seen exteriorly, but it can be viewed maybe by fibroscopy. That we are now going into the technicalities of it. We have, there are causes. There are things that will lead to the inflammation of this lining of the stomach.
Okay.
I don't know if we should.
Yeah, just first of all, before we get to that, who is likely to suffer with gastritis?
Right. Everyone is liable because the causes are varied. We have varied causes. We have infectious causes. We have alcoholic cause. We have causes from medications, smoking, stress. There are varied causes, and everyone usually will find him or herself in one of such activities. So it will cause gastritis, the inflammation of the stomach lining.
And if you're one of those who has been suffering with the problem of gastritis for several years, I think now is the time for you to call and ask questions as far as gastritis is concerned. We have an expert right here in the studio who explain to us how we can better manage this situation. Back to you, doctor. You said there are various causes that could lead to gastritis. When it comes to children, what can be the major cause?
For children, the major cause is what they eat. The eating habits. You introduced very well about the spicy food, about the acidic food. Now, there are various causes. In this presentation, I would really like that we should lay emphasis on the infectious cause. Now, the infectious cause, the bacteria cause, which is H. pylori. H. pylori, H stands for Helicobacter. It's a bacteria that is found, once it's found in the stomach, it lies at the pyloric region. The stomach has regions. The pyloric region of the stomach, and it will start causing hyper secretion of acid in the stomach. This H. pylori comes from what we eat. So like for the children, if you eat food that is not properly cooked, you drink water that is not filtered or mineral water, or you eat maybe acidic foodstuffs like oranges, like pineapples, in the stomach, it will cause this irritation. This germ, you tend to have this Helicobacter pylori germ that, especially the acidic foods, that will start irritating the walls of the stomach, and it will lead to this inflammation, which will lead to other complications that I think we'll talk about it later. So for the children, what they eat basically.
It's often said fruits are very important. Are you trying to say we should avoid oranges, we should avoid pineapples?
No. These fruits should be taken, and they are very, very important. But once there are signs of gastritis, like pain on the center of the chest, leading to the back or at the left side of the abdomen, or a burning sensation, then such food items should be avoided. But these fruits are very, very vital.
So is there a difference between gastritis and indigestion?
Right. Gastritis is a diagnosis. Indigestion is a symptom or a sign. Now, indigestion, which sometimes medically we'll call it dyspepsia, which is a burning sensation in the chest region that goes, if I say chest, I just want to localize where it is found from the stomach to the esophagus up into the mouth. So you feel that kind of burning sensation. It's a dyspepsia or an indigestion. Or you see someone when he or she eats just a little, you feel like you are too full. Sometimes you feel a bloating in the abdomen. That is indigestion. Those are signs of gastritis. So indigestion is a sign or a symptom, while gastritis is the diagnosis.
Our technician will soon be displaying the numbers which you can call and participate in today's edition of the program You and Your Health. Now, I want us to still focus on indigestion. So, does it mean when it comes to indigestion, how do we manage it? The management, will it be different from that of gastritis?
Right. Gastritis, as I earlier said, is a diagnosis, and indigestion is a sign. It's one of the signs to know that, no, this is gastric or gastritis that is implicated in this situation. So the management basically is about the change of lifestyle. And when it comes to like medications, now we want to see the cause. What is the cause? What has caused this particular type of gastritis, like the Helicobacter pylori, which is a bacteria. Now, if the cause of that gastritis is Helicobacter pylori, now we'll have to place the individual on antibiotics, on antacids. But if the cause is maybe this random taking of medications, non-steroids, anti-inflammatory painkillers, go back to the acidic foodstuffs or alcohol.
So there you're talking about treatment, right?
Yes, I'm talking about the prevention as well.
Okay.
These are the things that may cause that kind of situation of indigestion. So once we avoid these things,
then the problem of indigestion will be a story of the past.
It will be a story of the past.
But the fact that you don't take fruits too, can it cause indigestion?
No. Oranges, pineapples, I mean those acidic foodstuffs, they are not the only fruits that we should take.
Okay.
A gastric patient, you have to encourage the one to take fruits and vegetables out of the acidic group of fruits, like watermelon, you have bananas, you have other fruits other than of the citrus fruit family, and also pineapples.
So I'd like to talk to our technicians, please. They will soon be displaying the numbers. Okay, to participate in the program, you can call the following numbers: 670-547049. I repeat, 670-547049 or 656-622222. 656-622222. Those are the numbers you can call and participate in today's edition of the program, where we are talking about gastritis. Back to you, Dr. Glory. How common is gastritis in Cameroon?
Right. Immaculate, to really give you the percentage, I may not be exact, but I want to say that in every household, you will have at least 3-4 persons suffering from gastritis. Now, this gastritis caused by Helicobacter pylori is a very serious concern, because its complications are really, sometimes they are deadly. You find someone, suddenly it's fine, the one is fine. Suddenly, the one starts expressing with this pain at the level of the chest, radiating to the back or at the left side. And you find at one moment someone suddenly who is physically okay, suddenly starts vomiting blood or pooing blood, passing out bloody, maybe feces, stool.
Yeah.
Those are some of the complications that the gastritis caused by Helicobacter pylori can result to. Or you see someone with difficult breathing. So it is a very common occurrence because it comes from what we eat, from what we ingest. We say it's a kind of orophageal means of contamination. So it is really, really common. But to say the percentage, I cannot really. But in every household, I can say we may have at least 2 to 3%. Okay. Now, when there are the gastritis caused by Helicobacter pylori, at the beginning, it is very silent. You hardly know that there is something disturbing. Then, if you don't pay attention, maybe go to hospital for a check, for a test to be conducted for you to see. Then as the years go by, because once the H. pylori stays in the stomach lining, it increases the acidic production. It's just like you take acid and you throw on your skin surface. It's going to erode, it's going to peel off, it's going to burn you. That's exactly what is happening. That happens in the stomach when there is H. pylori involved. And there, at that level, it will start eroding the lining, the walls of the stomach, causing that inflammation. And as that process goes on, it may touch the muzzle layer of the stomach, because the stomach has layers. You have the mucosal layer, the submucosal layer, then you have the muzzle layer. It may touch that wound, that erosion may touch the muzzle layer. In the muzzle layer, we have the blood vessels running and the nerve fibers. The nerve fibers are what will give us the pain sensation. Now, when there is that kind of wound at the level of the stomach and the erosive process continues, it may cause a perforation. It may touch the vein, a vein or an artery, and suddenly you find someone vomiting blood or passing out blood, and they'll start accusing the neighbors, they'll start accusing the friends who are around. Witchcraft, poison, food poison. It's very common, especially with those who sit maybe in the bars, they are drinking, because alcohol is one of the risk factors to such a perforation when there is that gastritis caused by Helicobacter pylori. So it is a very serious concern for people to always go to hospital and check, because it comes from the things that we are eating, from the food that we are eating, the roadside foods. If we diagnose one with H. pylori, we always say avoid eating at the roadside, drink filter water or mineral water, avoid spicy food, avoid eating pepper, avoid, make sure you wash your hands properly before it, because Helicobacter pylori is equally found on the surfaces. You greet me, I greet you, maybe you went to toilet or even on the surfaces, So it's about equally the orophageal means. So it's a very serious concern.
So when you talk about avoid spicy food, does it mean we shouldn't eat food that has a little bit of spices in it?
Right. The spices here, we talk about the white pepper, the poivre blanc.
Exactly, white pepper.
The white pepper, then the pepper as well. It's true, some will say ginger will cure, but with some it will irritate. Yes. So the white, especially the white pepper, the component of the white pepper should be avoided in food. For those who suffer from gastritis, they can testify. When they eat such foods, you will see the signs and the symptoms will start. The pains will start. Immaculate, I want to say there are 2 types of gastritis. We have the acute phase and we have the chronic phase. For the acute gastritis, there we have the milder form.
I guess we'll have a call on the line. We're coming back to those types of gastritis. Hello?
Yeah, so this is Brother Oliver from Gabon.
Okay, sir. Your question.
Okay, now I've heard about the enlightenment of this gastritis. And, I've been contaminated by this gastritis since I was 5 years. Okay. And now I have heard the cause of this gastritis. I want to know then the way out, how to provide the solution of the situation.
Okay.
That's my lead.
Okay.
Thank you.
Okay. Should we continue with the types, or should answer his question directly?
I think we should answer the question.
Yeah, just answer.
So Now the way forward will depend on the cause of the gastritis. If it's the gastritis is about the inflammation of the stomach wall. If it's caused by alcohol consumption, alcohol should be avoided. Cigarette, it should be avoided. Non-steroids, it should be avoided. Now, if it is caused by this bacteria, H. pylori, Helicobacter pylori, you should go to the hospital for a diagnosis, because H. pylori is a whole complication. There you'll be placed, the physician will place you on antibiotics, antacids, and in some very complicated cases where there is persistence, resistance of these signs, these symptoms, it can even cause a stomach cancer. And in that case, we will be requesting the patient to do a fibroscopy, a biopsy, for a better way forward. It can even also cause an esophageal cancer. You find some people all the time burging. It's like there is something stuck on the throat, on the neck. They are not able sometimes to breathe. Sometimes they are dizzy. Sometimes they have palpitations. It's a whole lot, this gastritis. Most people, they live with it without really knowing. But when you go to hospital and it is diagnosed and you're placed on such antibiotics, antalgics, antacids, and if there's a persistence, you do a fibroscopy and a biopsy, you will be cured of it completely.
So that means there's definitely a cure for gastritis, is that it?
There is. There are people who are being cured completely. Now, when we say don't eat out of the house, don't roadside meals, don't drink unfiltered water, drink filtered water, mineral water. That is to prevent a recontamination, because there are people who get treated off, especially H. pylori, and after some weeks they get recontaminated because they re-ingest the bacteria all over. So it's about discipline, it's about prevention. They get cured. There is treatment for it.
If you say there's treatment for it, let's not talk about treatment. Let's talk about the cure. So in case I'm cured of gastritis, do I now have the we have another call on the line? Hello? We lost that caller. So in case someone has been cured of gastritis, does it mean that person still has a possibility of eating the citrus fruits we talk about and spicy food? And why not pepper?
Right. We have cases who have been cured of it, and they go about eating their pepper, spicy food with no problem. Okay. Now, and in that case, we encourage the persons to be very sensitive. Once they start expressing with those signs of one of it, indigestion, dyspepsia, or that kind of pain, the muzzle layer is being touched, then they have to start being keen by avoiding those things that will irritate the lining of the stomach. So it's about the irritation, because once the wound or once the lesion is already installed and you are properly treated, it gets dried off, it's about avoiding that such a wound should not get re-irritated for the signs and the symptoms to re-manifest.
Before we got that caller, you were talking about the different types of gastritis. You talk about acute and chronic. So can you still elaborate on that? Right.
For the acute gastritis, we have the mild form. That for the acute phase, it may run for a few days, a few weeks, and sometimes it heals on its own by maybe you eat vegetable. There are some that when they eat like the huckleberry, they really the pain they start expressing with those signs and symptoms. When they avoid, they are okay. There are some when they eat the pepper, they realize they are feeling the pains all over. When they avoid, they are fine. So with such acute phases, those mild, when they avoid some of the things that they will experience, that when they eat, it is going to irritate such manifestations, you see, they get healed even without treatment. But for the chronic form, treatment is very vital. Now, I equally wish to say here that people should avoid just going to the roadside getting medications, because those polypharmacies, especially the non-steroid anti-inflammatory like the ibuprofen, the diclofenacs, those are the elements that irritate the linings of the stomach. They cause such acidic manifestations, and they will cause you the chronic peptic ulcer, the wound. And when you have such a situation, it will touch the muzzle layer And we don't want someone to start vomiting blood. We don't want someone to start pooing blood. We don't want someone to maybe be running anemic, because equally there's a kind of bleeding that is internalized. In some cases, once there's a perforation maybe of one of those gastric blood vessels, you will not find the one vomiting blood or defecating or passing out blood, but you find the one having anemia all the time. And once maybe a fibroscopy test is done, or maybe a full blood count test is done, you find the one with that shortage of blood. In that case, H. pylori must be tested. And if it's persisting, in some cases we'll say go and see a gastroenterohepatologist.
You just mentioned ibuprofen and diclofenac. We know these are major painkillers used in Cameroon. Does it mean hospitals don't prescribe such medications?
Right. Hospitals do. They are great painkillers, but they will not prescribe to everyone.
Okay.
One suffering from a chronic gastritis or even mild gastritis will not be prescribed such a medication. There are people, so when you come in front of a physician, the physician will always pose occasions on immunoallergy. They'll ask you, are you allergic to any form of medication? Have you ever taken a kind of medication and maybe you feel a pain, you feel an itch or something? So in such a situation, you will not prescribe. Or have you been feeling some pain around the chest that goes to that radiates to the back? In such a situation, we will know this is a kind of gastritis and will not prescribe this anti-inflammatory non-steroids.
Okay, yes. Thank you so much. Okay. And that's why we put a cap to today's edition of the program, You and Your Health, aired on Equinoxe Radio Multimedia. I had as guest Dr. Glory Befeke. She is a medical doctor at the St. John's Hospital right here in the city of Douala. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Tipanda and Bertrand Bonzini. Have a lovely evening or a lovely day in the company of more programs on Equinoxe Radio and, of course, television. So long.